Hello, good evening, everyone. iMumz is back with another Ask Me Anything session, and today is the 102nd session of iMumz Ask Me Anything. And today we have a very senior gynecologist, oncologist, gynae oncologist, Dr. Bhagyalaxmi Naik ji with us. Dr. Bhagyalaxmi ji is from Cuttack, Odisha, and she is a very senior practitioner there. And she is very passionate about women health problems, and she is currently an associate professor and head of the Department of Gynecologic Oncology at AHPGIC facility in Cuttack. And she's also the chairperson of Oncology Committee of FOGSI, which is the largest organization for gynecologists and obstetricians in the country with 38,000 plus registered members. So we are very happy to have you today with us, Dr. Bhagyalaxmi ji. Welcome to
Thank
iMumz.
you, Ravi. Thank you, Ravi.
So for the
So,
yeah. So for the first 10 minutes, Bhagyalaxmi ji will explain about what are the tips to rejuvenate after the delivery, how to take care of yourself in the postpartum period, and she will take all your questions after that. And please put your questions in the comments box below, and Dr. Bhagyalaxmi ji will take them soon. Over to you, doctor. Please educate us on tips to take care during the postpartum.
yes. So, thank you so much, Mr. Ravi, and it's really आपका बहुत धन्यवाद करूंगी कि because you have taken such a big task on your hand to educate women on women's health, and which is really a passion and the need of the day. So my topic today is to discuss about postpartum care. So postpartum is a period which is a really a very delicate period which the woman undergoes so many kinds of psychological changes, physical changes, some mental problems, so many things to ensue. So we will discuss about that one by one. So what is the postpartum period? It usually starts from the day of the labor ends or when the day of the delivery to around 42 to 45 days. So that's the most crucial period because the antenatal period has been वो तो 9 महीना का पूरा अच्छा से हो जाता है. फिर उसके बाद this time is also very crucial and we have to take very care of we have to be very careful during this time also. So I'll tell you that the first and foremost thing in our part of the world is that cleanliness is very important to take care of. Women, I don't know, there are so many situations in which women think that they should not take a bath. I think that's a misnomer and we should keep ourselves very clean because this time is very important. There's a lot of discharge which may be mucoid, blood stained and foul smelling sometimes. So a good bath is very essential. Changing the clothes often, otherwise they stink and so much of infection will go to the baby because we expect that the mother should hold the baby all the time. That's called a kangaroo care. So the mother should hold the baby and that helps in building a rapport between the baby and the mother, and then the breastfeeding becomes established very well. So I think cleanliness is first important, and then comes genital hygiene. I think that is again important, that you should keep your genital area very clean because the area, everything is raw that time, so they are very prone for infections. And then coming to a nipple care, breastfeeding is an important thing. You should always train your baby. Mothers are very reluctant during this time because that's the time, the first 7 days is so important that you should take all the pins to establish this breastfeeding, because once that is done, it's done for quite a long time. So the first 7 days are very important. You have to exert yourself so that the baby does proper suckling, proper breastfeeding, and once it's established, lactation is established, your half your problem is solved. Because don't think that bottle feeding is easy. It is unhygienic, and with breastfeeding the baby is healthier. There's a lot of the baby is more intelligent. You avoid so many kinds of infective diseases. So please, mothers in the postnatal period, take a lot of time and give all your effort so that breastfeeding is established properly. And the first 2 days, the colostrum, which is the thick discharge from the nipples, milky discharge. So that is also important because it has a lot of antibodies in that, and this protects the baby from so many other illnesses. And then you should remember some kind of warning signs that could happen during this period, and you should not waste time by staying at home. For example, if you have heavy bleeding, and this could be of so many origins, the cause could be so many things, but in case it's heavy kindly go to your doctor, meet her. And if you're having fever, chill and rigor, so that's again a sign of some kind of postpartum infection. It could be in the urine, it could be some infection in the breast, in the uterus, anywhere else. So that is again another sign. And foul smelling vaginal discharge is again another sign in which you should immediately come to your doctor. Wound infection, of course, if it is in the on the vulva, if it's the episiotomy, which that's a routine incision which is given during the delivery of the head and is repaired, sometimes that may get infected. And then number two, if it is a cesarean section, if that also gets infected, so any kind of wound infection or discharge from the wound, again that's an alarming sign. And then coming to about diet, what about diet? What is the diet that should be taken? I think diet is should be a very nutritious diet. It should be a well balanced diet. There should be a lot of protein, lot of calcium in that. But and hydration is very very important during this postnatal period, because as you know, mother's milk is 90% water. So if the water content in your body is reduced, then lactation could fail or reduce. So I think hydration is very very important during the postnatal period. Drink a lot of water. Maybe it could be a little lukewarm water, which will help the blood volume to rise, and so the lactation to be established properly. And then coming to exercise, exercise should can be started from the day one after delivery, if not after cesarean section, because after cesarean section it may be a little painful. But after normal delivery, I think you can start your perineal exercises. The perineal exercises will help reduce the laxities that have happened due to the normal delivery. So how do you do this? It's like, suppose you are feeling to pee or go to the toilet urgently, but there's no space in the toilet. How you contract the muscles on the perineum so that you can stop the urine from coming out. So that's called a Kegel's exercise and can be started. So you hold the urine or you hold the muscles tight so that the urine should not pass. Breathe 5 seconds, and then again you can release, and so you can do this 10 times at a stretch. And then after the cesarean section, after the pain and everything is less, the first thing you can do is, usually I ask my patients to lie down on the tummy. That's the first thing that they can do after the pain is less. And of course, once the pain goes away completely, you can do heavier exercises like the abdominal exercises, so that your tummy that has become lax will go down, go inside. But people think that if they use the abdominal binder, that will go away, but that's a myth. It's just support for a few days only. But the tummy which has come out, the muscles which have become lax after holding the 3 kg baby, so the muscles will only go back after the tone is increased, and that comes back only with exercise. And that's the leg raising and the head raising exercises which that happen to tone up the abdominal muscles. Then coming to constipation. Constipation is a very common problem that happens during the postpartum period, that is due to various reasons. So I think to keep that from that away, hydration is important, and you should take a lot of salads and fresh leafy vegetables, and of course a diet which has lot of fibers like fruits and all those things. But still, if that happens, it may sometimes lead to some kind of piles, which are the and these are some of the anal vessels that could come out if you strain a lot. So this is, sometimes it does happen, but then don't sit at home and sit on it. It's very treatable. Go to your doctor, take some kind of medicine, and she'll tell you to do a seize bath. That is in a big bowl, take some warm water and sit inside it, so that the anal vessels which have come out get some warmth, and they really reduce. So this is a small problem. It's not a huge problem, but if you allow it to progress, like if the constipation is not treated, then it may become sometimes little very difficult, may become sometimes infected also. So that is again important thing. But the most and important thing that I think is, after around 14 days, especially for working women, they have some kind of psychological problem. What about my career? What will happen to me? What should I how can I take care of my baby? Then my in-laws, my career, my so many other things come into women's mind, and sometimes they go into real depression. So these are called postpartum blues. So I think we all have to be very careful about that, that these are all passing phases. Everything will go away. Every mother has gone through this phase, so nothing is going to happen. So I think we should all be very careful about the small psychological changes that would happen sometimes, especially for working women, and that's around 14 days. So I think we should have a real meditative lifestyle, and then coming back to all the postpartum problems will be less if you have had a proper antenatal care, if you had a proper antenatal adjustment with the pregnancy, that how you're going to lead your life after the delivery. So I think that's very very important. So I think a meditative lifestyle, and every woman in her life thinks that I should have a baby like Amitabh Bachchan or like Vivekanand. So how can that come? I think from the day one of conception, whenever the heart starts beating inside you, it's the time that you start communicating with your baby, and that's very very important. What we think that the baby doesn't listen, whatever you think also the baby is able to understand the vibrations. So it has been seen that in women who are alcoholics, the babies are really very behave very erratically after they are born. So I think whatever you talk, whatever you think, all your emotions are transmitted to the unborn child. So kindly mothers, be very careful about the life you are harboring inside you for the 9 months, because when they come out, it's your duty to see that they are born like a flower on the surface of the earth, so that they have to do so many good things for the society, and you have to inculcate in them the feeling of goodness, of purity, of peace, and that everything should come during the antenatal period. Don't wait that after they are born, when they go to school, I teach him this, I'll tell her this. So everything has to start right from the day you start conceiving. So your meditative state, your state of mind is so important, and that affects the child's livelihood, how he thinks, how he behaves. Everything depends on what you have done to the baby in the 9 months inside the uterus. And then even after he or she is born, it's so important that you keep in contact with her, talk to her, him or her, keep him or her close to you, because that keeps a continuous contact between the mother and the fetus. There's some prolactin which is secreted, and that's again affects lactation so well. And if lactation happens very well, the uterus which has been so big becomes smaller and smaller, and the bleeding problems after delivery also are less. So I think lactation, establishment of lactation is very important, and that's the emotional connect between the mother and the baby. That's important. And even if you do a good lactation for full 6 months without any bottle feeding, I think that's again a good contraceptive also. So sisters, please remember that after delivery, if you do not have your periods quite some time, it's a good thing, nothing to worry about that. If you have lactating properly, there's always a chance that you'll miss your periods. But at the same time, let me remind you that's not a sure test that you will not become pregnant. So even you, during that period when you are already missed your periods, it's also possible that you could conceive. So kindly take care of that about the contraceptives. So the best thing to avoid pregnancy after 6 weeks is to insert a copper T, which is very freely available and done in good hands. They really do not have any side effects. The side effects which people think that copper T has a lot of side effects, that's a myth, because I, as a practitioner, can tell you that when it has been inserted in good hands, has a very low rate of infection or bleeding problems. But for the time being also, you can take progesterone only pills which do not have any effect on lactation for the time being. But again, I'll tell you, you can take it maximum for 3 to 6 months, not more than that. So once a baby is born, you need to take a gap of at least 2 years, 3 years, or 4 years, 4 years minimum. And for that time, taking continuously oral pills is not a good advice. So inserting a copper T is the best spacing method that could happen. So I think all these things we have to be very very careful, because this postpartum period is very very important. So, and about exercise, I have already mentioned contraception, and a word about nipple care. I think a nipple care should start right from the antenatal period, because the women have some kind of nipple problem. They have inverted nipples and all those things. So nipple care should start from the antenatal period, and every time after breastfeeding, it's ideal to wash off the nipple from the extra milk that sticks to the nipple, so that you do not have cracked nipples, which is really a very painful condition. So I think I'm done. So we can take some questions, Ravi.
Yeah, sure, doctor. Thank you so much for speaking on such an important topic, doctor. We have many questions from the users already.
Can I take 1 more minute about vaccination? I think
Absolutely,
that's the
yeah,
best
yeah,
time because
yeah, yeah.
vaccines are now available for cervical cancer, and the age limit for this is up to a longer time. But younger women who have just delivered, that's the best time you can take your cervical cancer vaccines. So please remember, ask your doctor for the cervical cancer vaccine if it's available. I think that's the best time you can take it.
Thank you so much, doctor. Shall we start taking questions now?
Yes.
Yeah, okay, doctor. So first question of the day from Ankita. She has a baby, 12 days old baby. Congratulations, Ankita, for your delivery. She's feeding, she's breastfeeding, but the left side breast is paining, especially the areola area tip. She applied nip care ointment and then still it is paining. What to do?
Okay. The first thing is she should have some kind of hot fermentation because the areola is also paining. And in case there is some breast engorgement, I think the extra milk can be removed by pump or by pressing it. And if you're already using nip care, that's a good thing. But still, if it is still painful, I think you can still use Zyte gel, which is an analgesic cream which can be applied. And but you have to wash it off just before you breastfeeding. That's called a Zyte gel, which has some local anesthetic, so the pain is relieved before you give if you before you breastfeed your daughter.
Thank you, doctor. Next question from Neha. She's 12 weeks pregnant. आज एंटी स्कैन में फीटल एंटी 1.04 mm, CRL 56.12 mm, cervix measure 3.5 centimeters, placentas at posterior wall reaching and covering the internal os. इसका क्या मतलब है? क्या ये कॉम्प्लिकेशन है क्या?
नहीं नहीं, ये कोई कॉम्प्लिकेशन नहीं है बिकॉज ये जो प्लेसेंटा थोड़ा नीचे है, वो जैसे जैसे प्रेगनेंसी बढ़ता जाएगा, एज द साइज ऑफ द यूट्रस एनलार्जेस, जैसे यूट्रस बड़ा होता जाएगा, तो तब तक ये प्लेसेंटा अपने आप ऊपर उड़ जाता है इन 99% ऑफ केसेस। और 1% में ऐसे चांस है कि द प्लेसेंटा विल रिमेन वेयर इट इज, एंड सो दैट मे लीड टू सम प्रॉब्लम इन द फ्यूचर। बट आई थिंक अब आगे चल के जो अल्ट्रासाउंड होगा उससे पता चल जाएगा क्या ये प्रॉब्लम है नहीं है।
She has another question. स्कैन में कन्फ्लेंट आर्चेस दिखा है, 3V कॉर्ड ऐसा कुछ दिख रहा है, ये कन्फ्लेंट आर्चेस क्या होते हैं? प्लेसेंटा एट द पोस्टीरियर रीचिंग एंड okay, this you explained. So she wanted to know कन्फ्लेंट आर्चेस क्या होते हैं?
वो these are normal variants, उसमें कोई चिंता की बात नहीं है। अगेन द प्लेसेंटा इज रीचिंग एंड कवरिंग इंटरनल लॉस, तो अभी थोड़ा हम केयरफुल रहना है बिकॉज देयर कुड बी सम काइंड ऑफ ब्लीडिंग बिकॉज इट्स लो लाइंग एंड इंटरनल लॉस जो है वो अपना रास्ता है जो बाहर के लिए, तो कभी कभार वो ब्लीडिंग हो सकता है। तो अवॉइड टू मच ऑफ ट्रैवल या टू मच ऑफ हेवी वर्क, बट आई थिंक आगे चल के इट शुड गो अप। बट अभी शी इज हाउ मेनी वीक्स प्रेग्नेंट वो तो पता चलना चाहिए।
12वीं हफ्ता, 12th वीक प्रेग्नेंट मैडम शी इज।
हाउ मच?
12th वीक, 12 हफ्ते।
आई थिंक हाँ, कोई बात नहीं कोई बात नहीं, वो अपने आप जो प्लेसेंटा है वो ऊपर हो जाएगा। ठीक है,
थैंक यू सो मच मैडम, ऑल द बेस्ट नेहा जी। आपको घबराने वाली कोई चिंता की विषय नहीं है, जैसे डॉक्टर भाग्यलक्ष्मी जी ने कहा। Swapnil Gupta, is there any problem if there is a mild IUGR in the growth scan at the beginning of 8th month of pregnancy? And is there any scan to be done in the beginning of 9th month of pregnancy?
I think your doctor will advise you for a sequential scan because mild IUGR is nothing to worry about. And the first and पहले ये मैं बोलूंगी, first I should advise the mother to be happy. That's the first thing, and by that I think so many chemicals are released in the body that your baby will grow automatically. But in case she has, because that will lead to again stress leads to hypertension, hypertension causes IUGR. So कोई stress नहीं लेना है, mild IUGR is nothing to worry about. And again, if your doctor is skeptical about that, she can do some serial ultrasounds to see whether it's mild IUGR gets corrected or is worsening. So I think the best thing is nothing to worry and relax.
Thanks for the beautiful suggestion, doctor. Next question we have from Shilpi Marwa. She's in 33 weeks pregnancy and the baby weight is just 1.5 kilometer, 1.5 kgs. Is it something to be concerned about?
No, I think there are so many parameters that have to be taken into account when the baby's weight is taken. Because if the mother's weight is also less, we can't expect a very heavy baby. So if the growth is normal, the pattern of growth is normal, the baby weight is not really very important. So I think you should not worry too much about the weight. And it's only during the last few weeks or few months the baby's weight rapidly increases. So I think you will pick up well. Don't worry. If
Thank
the
you so much.
liker is normal, if the blood flow is normal, so I think everything should be fine.
Yeah. Thank you, doctor. Next question we take from Reshma Fareen. Hi, ma'am. Have gone through TIFA scan and mild prominent uh, pelvical system.
Pelvic
Something
alveolar system. Yes,
pelvic
yes, yes. Yes, yes. There could be some problem because sometimes the urinary tract of the baby may have some kind of a little valve which may be obstructing the urination, but then wo delivery ke baad bhi can be treated. So I think it's not a very alarming situation. So after delivery वो अपने आप ही correct हो जाता है. नहीं तो you can just consult a pediatric surgeon who can correct it for the baby.
Thank you, doctor. All the best. Beauty has a question. She's 5 weeks pregnant. She's suffering from the last 2 days with loose motions. Please suggest medicine.
ओके नहीं वो कुछ नहीं होता है आप थोड़ा दही ही ले लो सम काइंड ऑफ लैक्टोबैसिलस should be fine because 5 weeks pregnant means you're just pregnant so I think it's the best to avoid any kind of medication so drink a lot of water and some lactobacillus in the curd should be enough so if it is too much then I think you can consult some doctor and start some medicine but as of now 5 weeks be happy so and relax so don't worry I think it should be corrected with hydration only.
Thank you, doctor. Menaga's question. She's 36 weeks pregnant. How can she reduce the risk of tearing or episiotomy during vaginal delivery? 1 hour walking is the only form of exercise she's doing currently. And she also wants to
That's
know
fine.
how to recover, rejuvenate after the episiotomy.
Okay, okay. So I have told about, I think when reducing the risk of tearing or episiotomy is, that's no way how to avoid that. So in case there is some kind of problem or the baby is taking a very long time to come out of the perineum, I think the doctor will have to do a episiotomy for that. So that's not a very abnormal thing to think about that. So, and in case it happens, the repair has to be perfect but in spite of everything, the lax perineum happens because after the normal delivery, most of the muscles are little weakened. So to do that, you have to start exercising. So that I've told about, it's called a perineal exercise or Kegel's exercise. That's like when you are going to the toilet for peeing. So through the urine process, you can stop your urine and see how it feels. So when you are doing that exercise to stop the urine, the muscles which are contracting are the pelvic muscles. And so if you continuously do that off and on many times, the pelvic muscles will become stronger. And so that's a way of rejuvenation. I think you'll have almost a normal vagina after that. And of course, now many medicines are still available now for lax perineum. There are some laser surgeries being done. So you can try all those things, but I think the best way to overcome this perineal looseness is by exercise.
Thank you, doctor. Vaishnu is asking for suggestion after C-section. What sort of innerwear should be bought? High waist panties or usual panties? Please suggest.
Yeah, that's fine. Perfect. No issue at all with that. You can use that. But the important thing, very important thing is I always tell that all your underwear should be washed twice and changed twice. And because they are in direct contact with the wound, sometimes I think they should be properly washed with some antiseptics so that when immediately after surgery for a few days when the wound is still not healed properly, I think your underwear should be really very, very clean. And wearing a cotton ones are really helpful because India is really the moisture is too much. So I think we sweat a lot. So cottons are always better.
Thank you so much, doctor. Next question we have from one second. Yeah, Sneha Hariharan. Any way to reduce the red colored stretch marks? It's developing now for her.
Okay, okay. That's a normal part of pregnancy because your muscles are stretched and some of the cutaneous tissue it gets flayed out. So you get those stretch marks. But the simple thing is you can use some kind of moisturizer for that. And number two is that, and it should be usually used whenever the tummy is wet. Suppose like just after bathing, we use a warm bath followed by some moisturizer. But there are so many medicaments which are available, you can use that twice, and ideally it should be continued up to the postpartum period also, so that the stretch marks don't become too permanent, and they should be started early, not that after they happen. But at the same time, let me tell you that they will not prevent it 100%. So I think they will lessen the marks, but still you may have some of them. It depends on the quality of the skin also.
Thank you, doctor. Next question by Shilpi. She's asking for vegan diet suggestion. It's 33 weeks of pregnancy and the baby is 1.5 kilograms.
Okay. I think she was also there. Okay, she wants some vegan diet from which my baby acha, okay. You are a vegetarian, so I think a high protein vegetarian diet is the best thing you can use. I think every day you can take some yogurt. You can take some. The peas are also a good source. Rajma is a good source of protein. So, and of course, leafy vegetables, some. Uh, Colored vegetables you should take regularly. Those contain a lot of antioxidants like tomato, then turnips, carrots. All colored vegetables, they have a lot of antioxidants, so they will also help in the blood circulation, and rich protein like cheese and paneer. So that is again a vegan source from which you can take your protein, and regular milk drinking should be there. But in spite of that, you can have some protein powders which are available in the market to be added into your regular diet also along with that. And of course, dal also. Your regular use of dal, and it should be thick katori bhar dal, and less of rice is a better thing to do.
Thank you so much, Dr. Shilpi. You can check out our diet section as well. There are many plant protein sources which we recommended.
Yes, yes,
So I
yes.
can just check that as well. Next question by Reshma. She have gone through. Okay, now we took this question. Rajani, she's asking, can you requesting you to tell about what is subchorionic fibrin deposition means?
Okay. So chorionic fibrin deposition is not a very bad signal, but then there's some kind of problem with the subchorionic tissue, because chorion is the tissue between which the circulation occurs into the baby. So a subchorionic fibrin means there's some kind of separation between the placenta and the uterus. So it could be some kind of problem, but I think it's not a big problem, because if it gets come deposited somewhere else, the other part of the chorion which is healthy will grow up, and circulation will be maintained well.
Thank you, doctor. Priyanka's question, she is in 26th week of pregnancy and she had normal delivery with stitches. Now, what sort of exercises and diet should she? Okay, okay. Hello, doctor.
So
On May, okay, she had a delivery
she
on May
had a
20.
normal delivery. Okay.
I'm sorry,
She
Priyanka.
had a normal delivery with stitches. I can't
What
understand
sort
actually
of,
what is with stitches. Maybe
yeah,
she had a episiotomy or something. And
right.
now she is in 26th week of pregnancy. And what kind of exercise she should do? I think you can
Right.
look up on the net. There are so many kinds of exercise that are fit for pregnancy that you can do. There's so many things are there. Everything is on the net. And but I would also request you that to uh, continue a healthy lifestyle. So, and the first time has been a normal delivery with stitches. So this time it's more possible that you'll also have a normal delivery. So I think maybe in the second delivery usually would not require any stitches only, but if they are also, it's a normal phenomena, so nothing to be worried about that. And all the exercises what you can do, yoga, but more than that, doing a physical exercise, I would always like to bring your attention to some things that we are never think about, that we are always bothered about our diet, what we should eat, and about the protein, about the physical things. So there are other things which we should think about the mind. So the mindset of the mother is very, very important to bring about a healthy pregnancy and a healthy offspring. So I think kindly you also have to meditate, also have to take care of your mind, what you think, what you about others, and what is the thinking process. I think so always I advise my few patients, obstetric patients, that kindly do not see the horrible things that are being shown on the TV. So whatever we see, whatever you think, whatever goes on in our mind, all vibrates on our body, on our baby also. So kindly, because this is the common questions which we get from our patients, that what should I eat, what exercise should I do, but no one tells what should I do for my mind. So that's so important, and more important than the diet which we eat. Or so if you eat a good diet and are angry all the time, I think that's a very bad thing for the baby. So it's more important not concentrating, because that is normal. सब लोग जो खाते हैं हम भी वही खाएंगे. It may, you may take some little more nourishing things, but more than that, it's the state of the mind which has to be taken care of. You should be always calm, in a meditative state of mind. Talk to your baby. That's very, very important. And any negative, take out any kind of negative feeling from your mind. So I think the baby will be born with all the good virtues, whatever you want. It will be a healthy baby, it will be a happy baby. So kindly don't concentrate on physical things only. That matters, I don't tell it doesn't matter, but more than that, there are so many other things. Because we will all remember that when our grandmothers were pregnant or were carrying, they were told, you read good books, you read the Gita or whatever it is. So now we are all busy, we don't have time for all that. But there are channels which have show us how to think, how to meditate during pregnancy, and that's a real special time, I tell you. So you spend 9 months for the baby, and then the result which you get, and that's a boon for you and for the world together. So I think bringing out a healthy offspring is it's your, I think that's the thing you have to give back to the world. There's no way out. So whatever you have taken from the world and you want to give to the next generation is in your hands. So what you do in this 9 months is going to reap, and so the world will be a better place for everyone. We won't have any people, any crime, nothing will happen if everyone carries this 9 months very sensibly, so that the baby is born with all the virtues. We will the crime in this world, and the world will be such a better place for all of us to stay.
Thank you, doctor. Thanks for that beautiful words about the motherhood. Next question we have from someone asking, she's 23 weeks pregnant, when to have ferrous sulfate and folic acid tablets, in the night or in the morning, because she's getting stomach pain if she had it in the night time.
Okay, you can take it after lunch, but the best thing is the habit we have that please after lunch or after dinner, immediately it's not advisable to go to bed. So after lunch, you have to move about for half an hour and then go to bed, and even the same thing after dinner. So in after lunch, it's advisable to take a nap for a few minutes, and after dinner also, when you're going to sleep. Before that, I think you should have an early dinner and move about and then go to bed. Otherwise the food, it takes a little more time to digest when during the state of pregnancy than for other people. So if it takes a little more time to digest, so it's all the more possible that it regurgitates and then it feels very uncomfortable. So I think it's better to take during lunch, move about before lying down in the supine position on the bed.
Thanks, doctor. Rajinder Kumar has a question. मेरा 4.5 मंथ्स के बाद 3 बार अबॉर्शन हो चुका है. क्या नेक्स्ट प्रेगनेंसी में सर्कलाज के बाद मेरी प्रेगनेंसी 9 मंथ्स तक सेफली कंप्लीट हो जाएगी? प्लीज सजेस्ट. एंड शी इज कंसर्न्ड अबाउट.
मैं बहुत प्रसन्न हूँ, वट एवर इट इज. सो 3 times you have already aborted. So the next time we also pray for you, and we all are best of luck for you that you should conceive. And circlage is a kind of treatment, but then that's not the final treatment. So I think the more important thing is that you have to relax thoda. तो इतना टेंशन में actually most of the time वो the pregnancy becomes a little problematic if you have a lot of concern, lot of tension. So I think the best thing, have positive thoughts. ये मेरा बच्चा sure रहेगा, मेरा बच्चा sure रहेगा, ये pregnancy will be nice, this pregnancy will be uneventful. So you take all the medical treatment, but create positive thoughts. And I think there are many channels. You can go to the Brahma Kumari's website. We have Dr. So many channels are now there. You create positive thoughts about your pregnancy. Don't tell ये भी नहीं रहेगा, ये भी नहीं रहेगा, ये भी नहीं रहेगा. ये कहते कहते करते वो नहीं ही रहता है. तो ये प्रेगनेंसी अच्छा होगा, मेरा बच्चा अच्छा रहेगा. And that conviction is very, very important. So you should start from the day one you conceive. I think you have a strong conviction that I'll have a safe pregnancy and a healthy baby. So I think that's more important. But circulation दे सकते हैं. We take all the medical treatment. But again, I tell you that miracles can happen only with conviction. So अपना सोच बदलो, टेंशन नहीं लेना है. So you have to surrender some things to the Almighty. I think not everything is in our hands many times. So have a strong conviction, surrender, take all the medical care which is available, and I think I wish you all the best and prayers for you.
Thank you so much, Rajinder ji. We all wish you all the best. Next question by Bhanu. She recently done her TIFA scan. The echogenic bowel right side seen and mildly hypoplastic nasal with 4.5 mm. Is this something to be concerned about? The NT and double marker scanner good and with low risk.
Okay. So I think because the markers and everything is good, but there is some kind of echogenic bowel, I think we'll have to wait. So the other next test which your doctor can advise you is a NIPT, which is called a non-invasive prenatal test. That test also you can take in case you have to find out some kind of congenital malformation if possible. But because the present scan is your screening is normal, I think you can still wait for that. And echogenic bowel may be associated with some problem, but I think because your scans are normal, your NT scan is normal, I think you can wait.
Thank you, doctor. Next question. So we are taking questions in order. Ritu ji, हम लेंगे आपके सवाल, बिल्कुल लेंगे. Next, Surya Ravichandran. Earlier had a miscarriage, now 17th week pregnancy for second baby. Doctor prescribed Ecosprin 150 mg. Is it okay to consume?
It is perfect. It is perfect to take that. So no issue at all. Ecosprin is a mild because it increases your circulation to your baby, to your placenta. So I think it's a good thing. It has no side effects at all, and the pregnancy outcome is always better.
Thank you so much, doctor. All the best, Surya Ravichandran. Next question by Richa. She's very much hungry. She's feeling very much heaviness in the lower abdomen. She's 17 week of pregnancy. Is it normal or she needs to consult the doctor?
I think that should be fine because at 17 weeks there will be little heaviness in the lower abdomen because you are carrying. If it is painful heaviness, then I think you should consult your doctor. But little heaviness in the lower abdomen is acceptable during this time of the pregnancy. If it is painful, it's a different thing. Otherwise, it's okay.
Thank you, doctor. Shivali's question, she's 11 weeks pregnant and having severe gastric and morning sickness. As a result, she's unable to eat anything. She lost around 2-3 kgs. Will this affect the baby's development?
No, this will. First thing, let me clarify, Shefali, that this is not going to affect your baby's development. First thing. And second thing is that this vomiting and nausea, whatever that happens in early pregnancy, is more of a psychogenic thing. So please remember that it's more of a psychogenic thing. So always I tell my patients that when a woman comes with a second pregnancy, she already has a baby and is working. So they have no time to think about this pregnancy, about this vomiting and everything. So I have always seen that women, housewives, when they are at home and the husband goes out to work, So that time the vomiting, the nausea and everything becomes more and more. So kindly keep your mind out of it. It's a normal phenomena. It will come and it will go away. So don't worry too much about it. And whenever that feeling comes of nausea, please take your mind away, do something else, sing a song, see a good movie, read a good book. So I think with time it will go away. And number two, there are some little things that mothers will tell you what to do to avoid all this nausea. But with time, I think within a 15 days it should go away. So kindly keep your mind out of it.
Sushri mentioned that even in 15th week of pregnancy, the vomiting is not resolved. बहुत vomiting हो रहा है. Please suggest anything.
So I think if you have heard my what I have told my previous viewer, so it's almost the same. तो ये अपने आप चले जाता है. आपको ज्यादा चिंता नहीं करना है. Once in a while, vomiting could continue throughout pregnancy, also off and on. But the most important thing is you have to keep watch on your diet, what you are eating. So too much of fried food, too much of oily food, too much of sour. आई थिंक वो तो मन करता ही है खाने के लिए, पर दे रियली ये सब वॉमिटिंग को और ज्यादा बढ़ा देते हैं. सो काइंडली बी वेरी केयरफुल अबाउट व्हाट यू ईट. एंड अगेन प्लीज कीप योर माइंड आउट ऑफ दिस वॉमिटिंग. बार बार उसके बारे में सोचना नहीं है. वो इट्स अ नॉर्मल फेनोमेना, वो अपने आप ही चले जाता है. और उसके बारे में आप जितना ज्यादा सोचोगे वो उतना ही बढ़ता जाएगा. सो इट हैज बीन टोल्ड दैट when the nurse or the doctor is too strict about it, and आजकल I have seen, because in past years people would used to have so many pregnancies, and after when their third pregnancy they have two more children to look after, so they never had all these concerns. And now abhi there's one pregnancy and the whole family concentrate on the mother कि उसका vomiting हुआ, इसका vomiting हुआ. So I think we should not make it a issue at all about vomiting. So वो आता है अपना चला जाता है. And so I think keep your mind strong, and whenever you have some chance वो लेमन या कुछ वो सूंघ लो, take your mind out of it. कुछ दूसरा काम करो, बाहर जाओ, घूमो, look at the flowers and do something, and just you have to keep your mind out of it.
Thank you, doctor. Next question from Avni Sharma. It's been 6 months she delivered and still she is feeling neck pain in the knees and legs. So what can she do?
I think if she's still breastfeeding, I think calcium she can continue. But I think it's a lot of yoga or exercise she has to do for all these aches and pains. These are all vague things, and I think with physical exercise only most of them will go away. But still, if it doesn't go away, I think she can consult a doctor to find if there is some other organic cause to it, like some thyroid problem or some sugar problem or all those things. But if she's lactating, I think you can continue your calcium and protein. And of course, please do some kind of physical exercise so that your circulation increases and all these vague pains and aches go away.
Thank you, doctor. Nazneen, इनका सवाल है, it's 9 month में बीटरूट, कुकुम्बर, कैरेट, लेमन, टोमेटो मिक्सर करके जूस पीती हूँ डेली एवरी मॉर्निंग. क्या है बेबी के लिए हार्मफुल है क्या?
These are all natural things. Natural things are not harmful at all. So these are all natural things. Natural things don't harm anyone.
Thank you, doctor. Neha's question, she's 15 weeks pregnant. It's the third pregnancy and she's 35 years old. Is it risky for pregnancy at this age? And yeah, that's the question.
No, I will tell you it's not risky at all, because for all carrier women, I think they start their life after 35. So it's not risky. But I think you should have a routine scan, and your doctor will ask you to do an NT scan. And after this NT scan, she will tell you whether to do any further scans to confirm that there is any chance of any congenital malformation in the baby. That's all. It's not risky.
Thank you, doctor. Leena Mahajan's question, C-section. After C-section, can she start Surya Namaskara?
I think after C-section, you have to give it a 6 weeks rest first. So after the pain and everything goes away, then only you can start doing anything. So the first thing what I would advise you to do is please lie on your tummy. Whenever you're sleeping, please lie on your tummy. And once the pain and everything goes away, so it will take at least 2.5 months, and then you start Surya Namaskar and all. First you can do it lightly, and then you can go ahead with other exercises too.
Thank you, doctor. Umama's question, she's 14 weeks pregnant and suffering from abdomen cramps last night and now becoming more tough. if she lift her right leg, she's experiencing sudden back pain, and the pains are going through the stomach, she's mentioned.
Okay, okay. Actually, I'll tell you, there are some joint pains during this time of your pregnancy, and so sometimes movement of these joints could sometimes be really very, very painful. So the best thing is you could take a paracetamol for that, but most of the time with little rest it goes away. But about the abdominal cramps, I think you have to visit your doctor and find out what the cause could be. But about the pain on the back, I think you should not be worried about, because all the ligaments become lax during this time of the pregnancy, and so the joints are really sometimes painful when the bones the bones crash against each other, so move against each other.
Thank you, doctor. Shushri has mentioned due to vomiting, she's not able to drink milk.
So leave the milk for the time being. So I think after a month it will be okay. Then you can start on milk. But the other thing for the milk is you can add some flavor agents with add some kesar or something, and keep it in the fridge so that it becomes a little cold, and you can add some rose water, rose flavor, anything in that, and that can also be done. But still, if you're not able to do it, don't make it a stress. So I think you can take it after a month when you're feeling better. Doesn't matter now. So don't.
Yeah.
It should not. Food should not be a stress.
Right. Thank you so much, doctor, for this advice. All the best. Next question, Abusha. She's 39 weeks pregnant, and it is 28 months gap between two pregnancies. She have precious LSCS because of oligohydramnios. The current pregnancy is all healthy with AFI 12. Can she undergo induction?
Yes. She's 39 weeks and she's 28 months. Okay. I think she can have a short trial of labor, but your doctor is the best advisor. He or she will see what is the baby's condition after trying giving a short trial for labor. If everything is progressing well, then they can allow for a normal delivery, or you could have a cesarean section.
Thank you so much, doctors. So, all of you, those who are watching, you can unlock the baby care program, with a small subscription, and you can access to more music, meditations, and weekly webinars.
Yes, yes,
We do
yes.
exclusive coaching every Sunday. We cover all the important topics with Sunday webinars. So you can join them. There is an offer currently running. You can check this out inside the app. And if you didn't subscribe yet, please do subscribe to the baby care program and avail all the benefits, and go ahead with that, I suggest. नेक्स्ट क्वेश्चन रीतु गौतम शी इज आस्किंग, इनका पीरियड्स एक हफ्ता डिले हुआ है क्या, जानना चाहते कि क्या है प्रेग्नेंट है, कोई सिम्टम नहीं दिख रहा है मॉर्निंग सिकनेस वॉमिटिंग जैसा.
Morning sickness is not the surest sign for pregnancy. You have to do a urine test to confirm that, and in case you are pregnant, the urine test will show you that you are pregnant. So don't expect that morning sickness will tell you that you are pregnant or not pregnant. So don't try to invite morning sickness. That's not a very good thing to do. So always do the urine test first in the first urine test. So the kits are available in the market. So you need only 3 drops of your first morning urine. So from there you can know whether you are pregnant or not.
Thank you, doctor. We wish you all the best, Ritu Gautamji. Richa's question, she's 35 weeks pregnant. Her growth scan showed abdominal growth lagging by 1 week and grade 3 maturity placenta. Is it a cause of worry?
Not a cause of too much worry, because a 1 week lag in growth is not anything to be worried about. The gap can always be also bridged up, so it doesn't matter that the 1 week lag is anything to be worried. And of course, she's 35 weeks and your placenta has become grade 3 maturity. So I think the circulation to the baby is little slow. But now, since she's already 35 weeks, the baby is almost mature, so I think it's nothing to be worried about. I think you can your doctor will really counsel you if there is any problem to go for a C-section in case.
Thank you, doctor. Monica Yadav's question, she have a problem of spotting during pelvic examination. It has been found that her endometrial
Polyp is there. So I think no. If you have an endometrial polyp, please get it removed. So the first thing is that if there is an endometrial polyp which you have already seen, I think the first thing is that you should get it removed, so that and that's the best thing that will help you to conceive also. So spotting during pelvic examination is not a normal thing, and in case you've already found out that there's a polyp, the best idea is to remove that polyp. You can do it a hysteroscopy, and remove the polyp. So I think please get the polyp removed and then plan for pregnancy.
Thank you, doctor. Next question we take from Purvi. She's planning for pregnancy. Will you give me some tips for a healthy pregnancy?
Yes, yes, I think that's the best thing to do because unlike other mammals that are there on this earth, man is the only being who can think and plan. So I think once you have already planned, I really do not know what your age is, but I think if you have already planning, it's always a good thing to have a planned pregnancy. And so once you have a planned pregnancy, mentally you are ready to accept it. Mentally, you have to do so many exercises before that what you are going to do. So I think you should from now on onwards, in case you have any medical ailments or taking any medical treatment, consult your doctor and see that you take something which is safe for the baby, number one. And number two, in case you are having some kind of stress or something, please keep that away before you take the pregnancy. And number three is that you should be healthy for that. And number four is that your diet should be good. In case you are having some addictions, please stop that. And number four is that in case you are planning for pregnancy, I think you can take some vaccines also, so that we do not have those infections during pregnancy. And you can start folic acid tablets so that you have a good pregnancy. So all this you can start before pregnancy. And the most important out of everything is that you should be healthy and accept the pregnancy, prepared for the pregnancy. That's called pregnancy preparedness. And so have a positive attitude towards it.
Thank you, doctor. Chiranjeevi's question. Uh, his wife, I guess, she's 20 weeks pregnant, and from 16th week, she's getting sleep disturbance, and now she can't sleep at least 3 hours. Is it any problem?
So I should tell you that in case you are having sleep problems, so please don't do that. Daytime naps are really good, but in case you are having disturbed sleep in the night, it's always good to avoid the daytime naps. Number one, and number two is that in case you are having disturbed sleep during the night, kindly keep all your digital things away from you for at least an hour before you going to bed. Please do not see the TV before you go to bed. And number two, kindly try to meditate before you go to bed. So these are the three things I'll advise you. And so digital away from digital things. Don't check your WhatsApp before going to bed, and don't see the TV before going to bed at least for an hour. And three is do some kind of meditation on the YouTube. Beautiful meditations are available. I think 5 minutes meditation before you go to sleep will be the best thing. And so I think that's the only thing I can tell you, because you cannot take any kind of sleeping pills during pregnancy. And so you have to create how you get your sleep. So if there is any kind of stress, kindly keep it away, because sleeplessness is not a good thing for pregnancy. So I think you have to, so how to get out of stress is that the only two things is that either you change it or you accept it. So if possible for you to change it, you change it. Otherwise you accept it. And so, and accepting a situation which is causing stress is the best answer to it, easier, so that it will not be a stress for you anymore. So I think keep away from stress, because it's not a good thing for the baby at all.
Thank you so much, doctor. Baby Shamli is 39 weeks pregnant. Today she have a spotting with red color, and her delivery date is in next 6 days. Is it any problem? She's
No.
tense.
No, 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 no. Nothing to be tensed. It's a normal thing. It could be little spotting. So, in case there is some kind of pain or some kind of watery discharge, or some, if the bleeding is a little more, I think you can go. So if little spotting is just an indication that she is going into labor. So, I think nothing to worry about too much. If it is little more or something, so a little spotting or a blood stain, little discharge during pregnancy, I think it's okay.
Thank you, doctor. We wish you all the best, Shamli ji. Give us good news very soon and share this with the family of iMumz. All the best. Next question, Beauty, she's asking, please circulage procedure के बारे में बताइए. Is it safe?
Okay. Okay, Beauty. I think this is a very difficult question for me to answer because for last so many years, circlage was being done as a routine for all women who were having regular abortions or multiple abortions, and especially when it was a painless abortion, when it was thought that the cervical canal is not able to hold the baby, cervix is becoming shorter during pregnancy, and circlage was being given. But now the evidence shows that the other way it's correct, that we should give some agents to the uterus to calm the uterus, because if the uterus is calm, the cervix will not open. But circlage is being still practiced, but circlage is little risky because sometimes it could lead to some kind of infections. So I think there are certain indications, but first we should try with uterine calming agents, like there are so many hormones now available which will keep the uterus calm, so that circulation may not be necessary. But in case, in spite of that, also circulation becomes necessary, it is being given. And so your doctor is the best person to decide which will be the best for you and will decide which is necessary for you.
Thank you, Doctor. Next, last few questions of the day we can take. Pradnya, she's scared of natural delivery and want to go for C-section. Is epidural a confirmed way to painless delivery?
Yes, yes, yes. Epidural is a method for a painless delivery. So it is very, very safe. You can take that. Don't opt for a cesarean section. Your doctor will decide for you that you need a cesarean section or not. If it is only about pain, I think if your epidural is available, you can go for a painless normal delivery. So don't opt for cesarean section unless there is no indication for a cesarean section. So I think epidural is a safe, and it's a painless delivery.
Thank you, Doctor. Rashmi Chauhan, what can we take if we get common cold due to weather changes in pregnancy?
I think you should take some kind of natural remedies which are available in the home, like tulsi and all those things. And still, if it is not possible, cetirizine is safe. You can take for 2-3 days. And if you have any kind of fever or something, you can have some kind of paracetamol. That's all you can take without doctor's advice. So first, try natural remedies. If not, then you cetirizine. If still that doesn't work, you can take some paracetamol if there is fever. That's all I can tell, which you can take without taking doctor's advice.
लास्ट क्वेश्चन ऑफ द डे फ्रॉम अनिता सिंह मैम, मेरा 4th मंथ चल रहा है बट डॉक्टर ने अभी तक मुझे आयरन एंड कैल्शियम सप्लीमेंट देना स्टार्ट नहीं किया। पैंडेमिक की वजह से डॉक्टर से कांटेक्ट नहीं हो पा रहा है, क्या मैं एमवे के कैल्शियम एंड आयरन सप्लीमेंट स्टार्ट कर सकती हूँ?
Very much you can start, but for fourth month को हम आयरन कैल्शियम शुरू नहीं करते हैं, because if the hemoglobin is perfect, तो आयरन कैल्शियम अभी 4th मंथ से शुरू करने से कभी कभार वॉमिटिंग फिर शुरू हो जाता है, जो धीरे धीरे कम हो रहा है। तो 4th मंथ के बाद भी हम आयरन कैल्शियम शुरू कर सकते हैं। इन केस आपके पास वो अवेलेबल है तो आप वो ले सकते हो, कोई प्रॉब्लम नहीं है। आयरन कैल्शियम का ठीक ही है, सम आयरन कैल्शियम मस्ट बी सप्लीमेंटेड, पर खाना के ऊपर ध्यान दो, द फूड शुड बी न्यूट्रिशियस, और मन के ऊपर ध्यान दो, सो दैट यू कीप अवे फ्रॉम बैड थॉट्स। आपका एटीट्यूड हमेशा पॉजिटिव रहे, किसी के साथ कोई झगड़ा, कोई मतलब डिस्पैरिटी, कोई मन का वो नहीं है। सो कीप योर माइंड काम, दैट्स मोर इम्पोर्टेंट फॉर द बेबी देन योर एमवे आयरन एंड कैल्शियम।
Thank you so much, everyone, for joining this Ask Me Anything session. So stay safe, stay happy, and enjoy your pregnancy. We wish you all the very best. And a very, very special thanks to Dr. Bhagyalaxmi ji for joining this session.
Thank you, Ravi, for allowing me to share my feelings to so many pregnant mothers, so that they change their attitude and we get really healthy and very virtuous babies.
Right. So one thing I would like to share, Bhagyalaxmi ji is a professional gynecologist, and she, before this starting session, she was sharing so beautiful conversation that she is also looking at obstetricians and gynecology because she feels that this is the opportunity to bring the better future. So this is something which she firmly believes, and being a professional in gynecology, she her passion also lies in obstetrics and gynecology. And when we requested her to join this session, she was immediately said, "Okay, Ravi, let's do it because we have to give back to the society. We have to support our mothers." So thank you so much for having this attitude, doctor. One last question: can we take? Someone is asking. Can we take one last question, doctor?
Yes.
Sonia, she's 20 weeks and 1 day pregnant, going through insomnia from last week, and there are palpitations. Can she take any remedies?
I think we are today here for people like Sonia only. So Sonia ji, please understand that insomnia is a mind game only. So I think you have to control your mind. And I don't, I will never advise you to take sleeping pills during pregnancy. वो नहीं होता है बिल्कुल भी. So I think for your insomnia, you have to find out some ways because, and I'll really, Ravi, I'll like to repeat what I've already told, that kindly be away from all your digital things before going to bed. Try to not see the TV before 1 hour. Hear to some soothing music before going to bed, and any kind of stress, please keep it away. The stress of your office, let it be in the office only. So I think please be kind to your unborn baby who is there in your womb. I think you have to take so much care, because and you are not thinking about yourself only during this time. You have to think about the unborn baby. Whatever you undergo, that baby also undergoes the same stress. So kindly take care of everything. Do meditation, have a stress-free life, be happy, have a positive attitude. And I think you have to take care of your insomnia by all the physical methods that can be done, and don't pop any sleeping pills. That's not good for the pregnancy. So your baby is your responsibility, and how the baby will be born with all kind of virtues without any problems. Your insomnia will cause lot of stress, lot of hypertension, low circulation to the baby. There will be growth retardation in the baby. Baby will be jittery after, maybe have some attention deficit disorders. So all this happens due to some kind of problem in our wiring during pregnancy. So our mental wiring during pregnancy should be perfect. So whatever you think, whatever you feel, whatever you plan, everything is reflected on the the weight gain of the baby, whatever it happens, all the problems. So kindly keep your mind cool, meditate, and so that this 9 months is the best time that you can give to your child. So speak to the babies, tell him or her all the good things that you are planning for the baby, and talk to the child, so that at the end of 9 months we get a really virtuous child. So I think be a little digital उपवास वो बोलते हैं, थोड़ा डिजिटल उपवास करो कभी कभी. Actually WhatsApp has made our life miserable. So kindly keep away from your phones for the last 1 hour before going to bed, and the TV also. It's not bad to see the TV. I don't tell it's bad, but more than information, there's a lot of I don't know. It's too much. It's good to know, but I think I can't tell you what is the news is always sunsunny. So that sunsunny creates some kind of feelings in your brain, some kind of hormones are released, which really disturbs your brain. So we need a good night's sleep for the baby. So I think kindly follow all these methods. I think by today night, I think you start following all this, you'll have a good night's sleep. So thank you very much again.
Thanks a lot for all these wonderful advices, Bhagyalaxmi. Thank you so much. It's a privilege having you with us, such a senior professional with us. So thank you so much, everyone, for joining this session. We would love to see you sometime again soon, Doctor.
Okay. Thank you so much. Thank you.
Thank you. Have a great day, everyone. Bye bye.
Thank you, Ravi, again.
Bye, madam. Thank you.
For giving this opportunity. Yes. I enjoyed talking to all of you.
Thank you so much.
And good luck to you.
Thank you so much.
Wish you a lot of success.
Thanks a lot.